Hi everybody, Dr. Jason Strodheide, Dr. Dan O'Leary here with Strodheide Chiropractic West, and I want to welcome you to the first installment of chiropractic research and what we can do to help you. What we're going to do is we've decided to take it upon ourselves to start a weekly series of some of the information that's coming out in the research and the news and the press about what chiropractic is, what it does, what we can help with, beyond the conditions that most people think about when it comes to chiropractic care, which most people think about, namely lower back pain and maybe headaches. While we do great work with that, there's also a lot of other things out there that chiropractic can help with that most people just don't realize. So I hope you enjoy the time you're going to be spending with us every week. So you know we're going to do our best to keep the video short, that way we don't eat too much of your day.
How you doing? I'm Dr. O'Leary, and I'm going to talk to you a little bit about chiropractic and blood pressure, and then Dr. Strodheide is going to go over a few research articles that have to do with chiropractic and diabetes. I think you'll find these articles very, very interesting, and it'll expand your horizons a little bit on what chiropractic can really help with. First group I'm going to talk about of this chiropractic and blood pressure research articles is there is a double-blind, placebo-controlled study of 75 patients. And what they found was that patients that got a chiropractic adjustment, their blood pressure was lowered at a statistically significant rate, which means their diastolic pressure and their systolic pressure both decreased, which is really, really amazing. This next research article was done by the University of Chicago, and it was actually done by two MDs, so this wasn't chiropractic research. What they found was that they compared a chiropractic adjustment to blood pressure medications. Now you know how many people are on blood pressure medications these days, just about everyone. So they showed that the chiropractic adjustment was a specific adjustment to the upper cervical spine, which is the first vertebra of the neck, and it showed that it lowered blood pressure better than 2 blood pressure medications combined. The next study we have is another double-blind study, and it was done by Dr. Yates. What it showed was that adjustments not to the upper neck, but to the upper back actually decreased the systolic and diastolic pressure in 21 subjects. So we can adjust different areas of spine. In different areas of the spine, they go to different areas of the body. So we can actually adjust the neck and the upper back, and we can get changes in blood pressure.
So Dr. O'Leary, what you're saying then, and what you've shared with everybody so far today, is that basically this isn't just like a fluke one study that showed that chiropractic can have a positive impact on people suffering with high blood pressure, whether it be systolic, diastolic, or both. But what you've laid out for everybody is that basically there are multiple studies that are out there showing the effectiveness of what we do on people with high blood pressure. So just as to the layperson or to the person watching this video, what do you think they should do, regardless of where they live? Because obviously we're going to be on the internet. People are going to be seeing this all over the United States, maybe even all over the world. So if there's anybody watching this that has high blood pressure, whether it's uncontrolled with medication, controlled with medication, whether they're not even on any medication, what would your advice be to them based upon the current research that's coming out regarding chiropractic and the role that it plays in the management of high blood pressure?
You know, if you're trying to get healthy and one of your goals is to be healthy, chiropractic has to be part of your health plan.
Why do you say that?
That no matter how good you eat, no matter how good you exercise, there's research studies out here that show that you have to have proper spinal function in order to have proper bodily function or organ function. And no matter how good you eat, if you have a subluxation in the upper part of your neck or your upper back, then that shows that your heart is not going to function as good as it possibly could.
Got it. That's exactly true. And for those of you who haven't been patients of chiropractors in the past, Dr. O'Leary just used a word that was called subluxation. What that is, I always tell everybody, it's a big fancy $50 word, but basically what it is where one or more vertebra or bones of the spine have misaligned slightly. And it's not a big dislocation, it's just a minor misalignment, but when that happens, there's pressure that gets exerted on the nerves that exit off the spine that go out to every part of your body telling it how to work. So when a person has a subluxation, there's going to be an interruption in nerve signal. And if you're losing some of the nerve signal out to the parts of your body, then those areas, those parts, aren't going to be able to work as well as they could or should. Now, the first study that I want to go over with, as Dr. O'Leary said earlier, I'm going to be talking a little bit about some of the chiropractic research and studies that are being shown as our relationship to diabetes. And the first study that I want to go over with you today is, it comes from the Journal of Vertebral Subluxation Research. And what this study found was it was a case study of a unique individual. But what they found was that chiropractic is part of an integrative approach to the management of diabetes, is resulting in the return of blood and urine glucose levels back to normal and then actually stabilize. Now, the next article that I want to talk about comes from the Journal of Pediatric, Maternal, and Family Health. And this was also a case study, and this one's really interesting. But what it was is it was on a 4-year-old who had type 1 diabetes. And what they actually found, and what was diagnosed in addition to the type 1 diabetes, was that, once again, Dr. O'Leary, there was subluxation in the upper neck, so at the area of C1 and C2, the top 2 vertebrae in the neck. And what they found is the 4-year-old actually received 24 chiropractic treatments over the course of 2 months. And what they actually found as a result of the study was that her A1C levels, and for those of you who have diabetes, you're going to know exactly what A1C is, but her A1C levels were reduced. And not only were her A1C levels reduced, but she was actually able to be reduced from 15 units of insulin a day down to 11 units of insulin per day, which is very significant. Now, the really cool part about this whole thing, and I would assume for those of you that don't really know about A1C and what happens, it's very well known that even intensive medical care, medical treatment of type 1 diabetics usually does not, or often does not, result in a lowering of the A1C levels. And the beauty of this is the lower the A1C level is, essentially, if you think of it as the lower the A1C level, the less diabetic you actually are. So this study was awesome, very encouraging. I was really excited to read it. So the last thing I want to share with you today, actually, I read in the Natural News Digest. And it was there was some new studies that were coming out. And basically, what they were finding, this is studies that were being done up in Canada. And what they were doing is they were interacting with the nervous system, assessing nervous system function in laboratory animals on these animals that had diabetes. And what they actually found, and the scientists actually were dumbfounded, according to this article, the scientists were actually dumbfounded at what they found. And what they actually found, and as consistent as it was, actually allowed them to go on record and state that they had discovered and they had found that the nervous system, when it's not functioning properly, actually can lead to the development of diabetes. You know, and the reason for this is as in chiropractic, we've always said that your nervous system is what tells all the parts of the body how to work. So you actually have nerves that go to your pancreas, which tell the pancreas how to work. When things don't work properly, things go sideways and disease develops. So I thought it was really cool that science, not just chiropractors, because we've always said that we can help with diabetes, but actually science has actually come out and said that now that they've actually discovered, and they can emphatically state that an improperly functioning nervous system can be the trigger that leads to the development of diabetes.
Well, everyone, that'll do it for this week. I appreciate you guys watching. I know this video is a little bit longer than what we expected it to be, but there's some really good research out there, and we really want you guys to hear about it. So we talked about this week about diabetes and also blood pressure and how chiropractic helps improve the function of your body, which will help with these symptoms of these diseases. So if you're out there and you have diabetes or you have blood pressure issues at all, please try to find our office. We don't treat these conditions, but we help improve the function of the body, which will help you get over with diseases. Our office number is 636-530-1212. For more information, you could go to the website at www.goodback.com. We appreciate you listening.
And Doc, if they don't live in the St. Louis metropolitan area, what do you recommend that the people who are watching this do?
Get a hold of us, and we can try to set you up with a good chiropractor, or try to search out some chiropractors in the area. They will definitely be able to help you.
Awesome. Once again, thank you for your time and attention, and we look forward to seeing you next week.